All right, today we're going to talk about garnishments. I just got, did a live Q&A the other day, and someone asked about it, and she went and checked it out, and she actually got some more money from child support she was due for quite a while. So we're going to talk about that exactly, what type of garnishments Social Security Administration can withhold, when, how do you get it adjusted, how do you get it deleted, reconsideration, appealed, whatever the case may be. All right, so this is a live broadcast. If you're watching this later on a recording, make sure you subscribe because right now I'm going to talk about garnishments for about, it won't take that long, 5 or 10 minutes. And then I'm going to open it up for any questions you have. So make sure you type the questions. Already got some questions in there. Awesome. And go ahead and type your questions in chat, and I can address anything on all things Social Security, retirement, disability, survivor benefits, spouse benefits, all the rest of it. I've helped millions of people out. I've taken hundreds of thousands of applications when I worked at Social Security. So I can walk you through the bureaucratic beast maze. All right, let's go ahead and get started here. All right, so this is, I don't want to get too technical but it's a section that the Social Security does have legal authority to withhold benefits from your Social Security check to enforce legal obligation. So if you owe a friend or something like that, and they can't take money from your Social Security check unless you give it to them. But in terms of legal obligation, child support, alimony, restitution is kind of a vague term. But Social Security does not make retroactive adjustments. So if owes somebody, for 10 years of child support or something like that, Social Security doesn't go back and make retroactive adjustments like that, but they do have it going forward. And I ran the third busiest Social Security office in the country, and we had one person, that was that person's job pretty much. They spent probably 75% of their day doing garnishment, court order garnishments. So how the whole process works, if you owe back taxes, federal student loans, child support, spousal support, certain categories, it has to have a court order. And so you go to the court and you get the court order, and you can't just take it down to Social Security. So when you have any type of changes, you're paying child support or alimony for a few years, and all of a sudden you go to the court and get it reduced. A lot of people used to come down with a court order and hand it to us and say, hey, I just got this reduced or deleted. And we say, well, we can't do anything because we used to get fraudulent documents late, fraudulent court orders, because we'd get the court order later and it's like, oh, how come you didn't give us this page? So we have to get the court order directly from that particular court, wherever it is in the country. So whatever court if you're in Miami, but the person that is going to be paying the debt is in Portland, Oregon, then it's sent to the Social Security office in Portland, Oregon, and they make that input into the system to do whatever the court orders the Social Security Administration to do. So whatever garnishment needs to take place, $200, $300, $500, or whatever from your Social Security benefit, the Social Security Administration will do it based on that court order. All right. So again, it's, federal court orders, student loans. Haven't seen a lot. Most of the time it's child support, and probably 80% child support, alimony as well. It's interesting. The case we just helped with, it was her. She was owed child support, and the ex owed child support for decades and worked at under the table jobs or, shade tree mechanic or whatever the case may be. So never paid child support. And then he turned 62 years old, filed for benefits on his own record, and then filed for spouse benefits on her record. So he got more money on her record because she worked more and paid into the more system, and her benefit amount was twice his amount. So he was able to get money from hers, and she didn't know that because Social Security doesn't say anything like that. Doesn't notify when you receive, divorce spouse benefits. But she found out somehow, and she asked that question. I said, well, now he is receiving federal benefits because he's receiving money from you. It's kind of that takes some cojones, I guess, to do that, to, owe the person child support and then get benefits off their record. But anyway, but now this person is not a shade tree mechanic, is not getting paid under the table like they have been for 20 or 30 years. Now that person is actually getting federal benefits, and that can be garnished. And she's like, oh, that's right. That's right. So she goes back to the court reissues it, send it to Social Security, and now she's finally getting her child support after a few decades. So it is possible. So if you disagree with a garnishment, the court issues a garnishment that's incorrect, or the amount is incorrect, or the start date or the end date is incorrect, or something like that. Don't go to the Social Security Administration, because they cannot help you. They can only follow the court order. Again, you can't take your court order down there personally and hand it over to them. They have to get it directly from that particular court. You can't go down there with a court order and say, look, they were only supposed to hold back $200. How come they're holding back $300? The Social Security employee will just say, go back to the court and tell them that, and have them send us a new court order so we can make the adjustment. That's no problem. Social Security, they make the adjustments all the time. Courts mess up, they delay, whatever the case may be. So that's not an issue. There's also a taxpayer relief that was passed back in 1997, authorizes the IRS to levy up to 15% of Social Security payments for overdue federal taxes. So if you owe tax debt, the long arm of the law, I guess, they can withhold up to 15% from almost all benefits. One benefit that almost can never be touched is SSI. And SSI, a lot of people mistake this. SSI is the welfare-based program. I did a video a few days ago and the thumbnail was SSI is welfare, and nobody watched the video. They just looked at the headline, and they say, well, is that no welfare? I paid into it all my life. And I said, please watch the video. Yeah, people make comments without watching the videos. And so anyway, SSI is welfare. It's the supplemental security income. So when people say SSI is not welfare, I paid into it, they mean SSA. So Social Security Administration, your retirement survivors, disability, yes, you pay into that, but you do not pay into SSI. That does not come out of the Social Security Trust Fund. That comes out of general revenue. So I guess, you pay taxes, but it's a welfare-based program. And because it's a welfare-based program, yeah, it's very difficult, if not impossible, to take any type of debt out of that, because the amount is, just barely enough to survive. So if money comes out of that, then that person will basically not be able to survive. All right, so I did that in about 8 minutes, so that wasn't too bad. So garnishment, yeah. So if you have any questions on your particular garnishment or anything like that, make sure you type it into chat there below. And let's go ahead and jump into the questions. I have about 45 minutes or so for questions, and let's see what we got. Imaginator, what's up? Son's mother tried to defraud the child services, telling them I have never spent time with my son, and when they sent me the letter to appear before I brought my pictures. All right, so it sounds like it's all right. So not a really Social Security question there. Thank you, Doctor. Yeah, appreciate it. Thank you. I am retired and have a young wife and 3 small children. Does my wife get a benefit from Social Security? Possibly. Okay, so retired and have a young wife. Okay, so you're retired, so you're currently receiving retirement benefits, I guess, from Social Security. Okay, and if you have 3 small children, hopefully you've already filed for those. It's called an auxiliary claim for your children, and your children are receiving up to 50% of your PIA, which is your primary insurance amount. So hopefully they're receiving that. And if that's the case, if you're not, then call Social Security immediately and say, hey, how come y'all didn't take, claims for my children? They're entitled to benefits on my record. There's a family max involved if you got 3 kids, and there's a maximum that can be paid out. I did a video on the family max, but the Social Security employee will tell you what is the maximum amount that can be paid out. And in terms of your wife, if she essentially stays home and to take care of the kids, and the kids are under 16 years old or became disabled before the age of 22, there is what's called the auxiliary child in care. So one of the parents can stay, they can work as long as they stay under the annual earnings limit, the $22,320. As long as they're under that, they can continue to work and get this child in care benefit. So she can also get up to 50% as long as one of the children is at least is under 16 years old. However, there is that family max issue in there. Um, so if there's, let's say $3,000 able to be paid to these three children, then each child, and the family max is, again, the family max is 3,000, then each child will get $1,000, $1,000 if, up to 50% total amount. Let's say the 50% is 1,000. So each child will get 1,000. And then if that's the maximum, the family max is 3,000, and she goes on there, then that 3,000 will just be divided by 4 instead of 3. So the total money coming into your house will be exactly the same. So a lot of people just say, yeah, forget about it. I'll just go ahead and give it to the kids. However, a lot of people losing money here is when that situation changes. You can only get $3,000, but then one of the children turns 18 and stops receiving benefits, or graduates high school, stops receiving benefits. And then there's money left on the family max. And if your wife is still not working at that time, have her file for child in care. As long as there's still one child under the age of 16. So it's all about the family max in your situation. So call up, and whoever took your claim should have talked to you about that, and say, hey, any money left over on the family max. All right. Hello. Surviving spouse benefits. Divorced ex-spouse passed in December. Neither of us remarried. I am disabled veteran of 59 at 70% disability. Applied for surviving spouse benefits and was told that I was not considered disabled for Social Security. Okay. Yeah. In order to get surviving spouse benefits at 59, you would have to be disabled. That's called disabled widows benefits. From 50 to 60 years old, you can get disabled widows benefits. You're essentially getting them on your deceased spouse's work record. But they have to prove that you're disabled. But it looks like you weren't able to do that. Hopefully you filed a reconsideration and gone through that whole process. Make sure you check out the videos I did 4 videos on disability, the entire process and appeals and everything. But the appeal process for disability, definitely, check into that. But also, once you turn 60, sounds like you're going to be 60 very, very soon, you can apply for regular old surviving spouse benefits, and you don't have to be disabled. Your benefits are reduced because you're going to be received those at the full benefit amount. Even if you were approved for disabled widows benefits, you're only going to get 71.5% of your deceased spouse's primary insurance amount. So number 1, appeal that. Number 2, 60, check out your surviving spouse benefits and see if you want to start it at that time. Jackie, relative is 70. Can they apply for SSA? I don't know why they waited so long. If not survivor spouse, anything else? Yes, I get that all the time. I'm 71 years old and I just never got around to filing. I didn't know what to do. And it's like, after 70, you're just way losing money, because you get up to 70, at least you get those delayed retirement credits. But after 70, you get no more delayed retirement credits. So so if your relative is 70, now it's still a good time. They can start their benefits. The best is, on that month they turn 70. That way they get the full, 24% or 8% every year for delayed retirement credits. So please, please, please make sure they go down there and file for those benefits. Did they forget to file for Medicare too? If they didn't have health insurance from work and they need to sign up for Medicare, then they won't be able to do that until January during the general enrollment period. And then they're probably going to be charged 50%, maybe even a 60% penalty for not signing up for Medicare. So yeah. But yeah, in terms of surviving spouses, they can file for surviving spouse benefits now. They don't have to wait till 70 because, it doesn't increase for surviving spouse benefits. So please call first thing Monday and set up an appointment and talk to someone and say, should this person go ahead and start their survivor benefits now and then wait a few months until 70 or whatever the case may be. So yes, please, please help them out. Okay, let's see. I already answered that one. When children are under 18 receive Social Security, when their parents start receiving Social Security, how often is SSIRS asking for money back when the child reaches 18 if there is money remaining in the child's account? Never. Yeah, so you're talking about like kind of the representative payee, where I did a video on that. So watch that video. I've done over 500 videos. There's always a video out there I've done. That's, you're the representative payee for the child, and every year you get that payee report, and it says, hey, we sent you, $12,000 last year. What did you use it for? Roof over the head, food, PlayStation, whatever. But no, yeah, if it's your natural child, adopted child, stepchild, whatever the case may be, then no, it's gone to their welfare. You're good. Future education, send them to school, buy them a car, whatever the case may be. If we're talking about your kind of a foster care situation or kind of a group home situation, that's a little bit different. Then that's their money. But yeah, if you've been using pretty much that money for food and clothes and all that kind of good stuff, yeah. Does Social Security garnish alimony? No child support back funds. Yes, alimony. Yes, alimony. If you have a court order, absolutely. SSDI, SSDI something 32, is that welfare? SSDI is not welfare. SSI is. SSI is the one you pay into when you pay FICA taxes, Social Security Disability Insurance. SSI is the welfare one. It's different. You can receive SSI and SSDI at the same time. A lot of people receive both of those. Ex-husband passed owing IRS. Can they take any of that out of my survivor benefits? The IRS can do all kinds of crazy things, but I haven't seen that happen because it's that person's debt, and survivor benefits are an entitlement you earned because you were married to that person. I haven't seen one of those. So you're probably good. I wouldn't worry about it. The phone number, is that the right contact number for burial insurance? Yes, yes. So I've tired of all the bad actors out there doing people wrong in terms of Medicare and Affordable Care Act and even burial insurance, because that $255 burial insurance Social Security gives you just ain't enough. So I put together my own team. You can call, leave me a message, tell me your name, phone number, your state, and say what you need help with, and I can have someone reach out to you, or you can email me, and they can give you your options. All of it is 100% free in terms of going over all your options. And if you like it and you enroll or whatever the case may be, then those people support this free help. Thank you, doctor. You have answered my question. Awesome. Good deal. Thank you. You're welcome. Thank you. Welcome. Dave, son, disabled adult child, 25 years old on SSI. Mom, 63, dad, 67. Neither started Social Security yet. If mom filed for Social Security at 63, will the Social Security automatically file son for SSDI on mom's record? Pretty much, not automatically. You have to go through the whole process, but SSI is a welfare-based program. And anytime there's money out there for someone to receive an SSI, then they kind of mandate you to get that. So you get off get out of SSI and get actual, benefits they're entitled to. And it's probably going to be more money. But then there's the issue, and the unfortunate issue of if the son is receiving Medicaid from the state and now starts to get child benefits, disabled adult child benefits from the parent, and that puts them over, they may get more money, and that might stop their Medicaid or whatever the case may be. That's an unfortunate part of all that. But yeah, because both of those, SSI and Medicaid, are welfare-based programs, they mandate you to get any money out there. So it's like, if somebody's on SSI and they win the lottery for $1 million, it's like, no, I want to keep my Medicaid, so I'm just not going to take my lottery money. I'll just let it, whatever. I won't go down there and cash in my ticket. It's kind of one of those type of situations. Can you apply for SSD if you have a pension? Yes, absolutely. Pension doesn't affect anything for regular SSDI, that is. Let's see. My company offers an ESOP plan for employees that work for over 1 year. Account is now at around 17,000. Will that cause a problem when I retire? Nope, not at all. Social Security, that's the three legs of the stool. The when you retire, you get your Social Security benefit, you get your pension that are slowly disappearing, and then you've got your own savings. So those are the three legs of the stool. So Social Security, encourage you to get all of that. All right, let's see. I have disability retirement. I was a county employee. If my husband passed, can I get his benefits? All right. So the county employee thing, that's the issue that might be an issue. If you worked for a county that did not participate with Social Security, and you are receiving a non-covered pension from that work, then that's going to offset your benefits from your deceased spouse. Um, yeah, so it's called the government pension offset. But if your county did play with Social Security and did pay into Social Security, then nope, pension won't affect any of that at all. My son gets SSI from being intellectually challenged. Is he eligible instead of 4% of my husband's? Yes, yes, absolutely. If your husband has filed for retirement benefits or disability benefits, that's the first question. Well, the seventh question that as part of the claims process, I'm doing 100,000 of these, so I'm trying to remember what number question was. Anyway, but yeah, the Social Security employee, when they take a retirement claim like that or disability claim, they ask you if you have any children under the age of 18 or any children that became disabled before the age of 22. And you say yes, then they automatically take an application to get that child more money. Let's see. Can he get my husband Social Security? Husband is 73 and did not collect Social Security until age 69. So again, yeah, if a child is under 18 or became disabled before age 22, absolutely. Let's see. Can a 39 disabled being on SSI get more money when father retired? Um, Again, same type of situation. If you can prove that you became disabled before the age of 22 and you means you're a disabled adult child, absolutely. That's the trick. Good afternoon. Happy Saturday, everybody. Hey. All right. Going through the questions here. This spouse of a deceased veteran. Yeah, veterans benefits don't affect Social Security at all. No, offsets or anything like that. The only thing that veterans um, any effect on Social Security if you are receiving disability from the VA. You can receive Social Security disability as well. And to file for it, it's actually a little bit quicker because the Social Security computer system talks to the VA computer system, so they get the records a little bit quicker. The only other thing, I guess, is Medicare. If you're retired and you get TRICARE for life, they make you sign up for Part A, Part B. Usually that's enough. Some people get a Medicare Advantage to get some extra benefits, but you can go either way on that one. If you're not retired, like I was, sergeant in the Marine Corps, but I only did 8 years. But I'm a veteran, but not a retired. So I can't get TRICARE for life, but I could get, Veterans Administration health care. So some people that get VA health care are happy with it. And they always want to refuse their Medicare, Part A, Part B, because hey, I go to the VA and it's, I'm happy with it and stuff like that. That's fine. I would definitely take Part A because after all, that's free premium, and then Part B. I would think about it, and you'll say no, that's $174. Yes, but there's plans out there called Medicare Advantage plans that will pay for all or part of that Part B premium. They're called Medicare Advantage Part B Give Back, and they're usually called Honors Plan or Patriot Plan because that's who signs up for them as veterans. So, and then you get other benefits, dental, and you can get, maybe a second opinion. And if the VA it doesn't have an appointment, you can go to another doctor down the street. So that's an option I would definitely check out. So if you're interested, find your broker or agent in your area, or give me a call or email me, and we can have someone reach out to you and yeah, see if they can help you out. Give you all your options. Let's see here. During the MOE, told eight during the M, I'm- during MOE. Okay, there's different ways to read that. Told 1860 max earnings. Work paid me accrued vacation. Does that? Oh, okay. All right. So you're probably talking about not the MOE. That's month of entitlement for Social Security. You're probably talking about the trial work period, that 9-month period, and you went over, or your EPE, your extended period of eligibility. So you're on disability and you worked over 1860 in a particular month. Anything over 1860 in a particular month during your extended period of eligibility, which is that 36 months after your trial work period. Isn't this stuff all confusing? But that's why you got me. Then, yeah, if you didn't work over 1860 that month, but you got something for some type of prior period, then you can just make that argument. So the Social Security system probably won't catch that and say you made too much and stop your payments. But if they do, just go down there and say, yeah, this is for a prior period and yada, yada, yada. And they'll correct it, and super, super easy. No problem. All right. Let's see. SSI supplement told me that I can't receive more than 2 months worth of back pay. So will they give me less my second time and give me the rest my third time? Oh, okay. So yeah, so people that are recently approved for SSI, supplemental security income, if they have a big back pay, like a year or so, SSI, they break it up into different payments. If you're approved for SSDI, Social Security Disability Insurance, and you have $100,000 back pay coming, Social Security just writes you a check for $100,000. No problem whatsoever. But if you have SSI, yeah, they have to break it up into 2 or 3 payments. So yeah, they'll tell you, but you can make the argument and say, yeah, I'd like to get my first payment or my second payment a little bit more, because my car broke down, or I need to it's going to get hot here, I need a new AC in the house, and just make that argument. And yeah, the SSI claim specialist that's working on your case, hopefully they have a tad bit of a heart, which almost all Social Security employees do. You probably disagree, but 99% of them do. We always remember the bad one. My office, 99% as well. We got rid of the other 1%, luckily. But yeah, just call the person and tell them, hey, thanks for all you're doing, yada, yada, yada. But, I need an AC. I need a card to get my doctor's appointment. So could you, cut me a little bit, a bigger check the first time, or whatever the case may be. No problem. Dave, thank you for your answer. Very complicated, because in North Carolina, we get CAP program benefits for DAC, son, for keeping him out of group home. Yeah, yeah. Each state is a little bit different. North Carolina, it's interesting. I had someone that was in one state, and they were receiving Medicaid because in that particular state, the state didn't count the person's disability benefit amount against their Medicaid. They moved to North Carolina, and then the person lost Medicaid because North Carolina counts Social Security benefits for Medicaid. So yeah, each state is different. So it's and it's going to get, as I always say, there's exceptions, and there's over 20,000 pages of Social Security policy. And I'm doing a video tomorrow, and it's all going to change. It's all, yeah. I thought I was going to be able to retire for the 3rd or 4th time after Social Security started improving customer service, but Supreme Court ruling has pretty much ended my retirement for any time in the near future, because I need to be here and help you all get everything you're entitled to, which is going to be even tougher in the future. But all right, well, I'll talk about that tomorrow. My city does not pay Social Security tax. Will my pension be deducted from my Social Security monthly benefits? Yes, it not deducted, it will be corrected. You will not get the extra welfare benefit. That's basically what it is. Watch the video I did on Take the WEP challenge. And what it is because you didn't pay into Social Security. Social Security, thinks you've been homeless for the past 30 or 40 years because you didn't really make anything, because the earnings you did make weren't really reported to Social Security. And so Social Security thinks, okay, this person's been eating out of the garbage can for the past 20 or 30 years. Let's give them a whole bunch of extra money. And, but then you haven't hopefully been eating out of a garbage can for the last 20 or 30 years. So they're going to recorrect that and not give you the extra welfare benefit. So people don't understand that system. They just think, people think what they want to think. So Melissa, question. I'm 56 on SSDI. X will be 62, owing years of child support. He worked under the table. There we go. Can I heed any attempts of him drawing onto my earnings before he turns 62? Yeah, if your benefit amount is higher, then hopefully he does, because it's not going to affect your benefit amount. So, have him file, so yeah, go down there and file, and then head down to the court and get your child support. Yeah, so as soon as he starts getting a check, then, have the court order waiting there for him. And so this is the same type of situation as that other lady. That person, your husband, ex-husband, is going to go down there and collect money on your record, even though they owed child support. And but now you can go down there and bring that court order, kind of reissue that court order. And it depends what your particular court, your how your court does it. If it's still an active child support or whatever the case may be, then just tell them that, hey, this person is now getting federal benefits, so can you send that to Social Security? And they'll do it to it. Jackie, I will have to ask the question again later. I am in an area not good reception. Okay. My car's messing up too, so I might just tell disability I need that emergency release fund to get my check engine light off. All right. There's a trick for the check engine light. It involves a pair of scissors and black electrical tape. Cut about that much of black electrical tape and put it over the check engine light, and the check engine light one. That was the same solution for VCRs that kept flashing 12. So, all right. I should be getting SSDI for mental health in the next few months, and wanted to do something for my brother who helped me out a lot during my 3-year wait. If I take him on a vacation or something, will that be a black mark on me when I have a CDR? No, because you're going to be receiving SSDI, so you can do whatever you want with that money. It's your money. So that Social Security can't tell you what to do with it. But if you have, mental health issues, so yeah, I was going to say, if you have, back issues and you go to Jamaica and do paragliding or something like that, and someone takes pictures, then, usually it's someone that doesn't like you or something, and you're jealous, your next door neighbor, and sends pictures to Social Security all the time of you mowing the lawn and stuff. But mental health issues, yeah, not an issue. So have fun. And tell your brother thank you for us, from all of us, for looking out for you. Yep, there we go. That's what we want more of here, is family looking out for each other, and this community looking out for each other. Is this going to be recorded so we can watch it later too? Absolutely. All of these are recorded. So you just go into the YouTube homepage. You just type in Google Dr. Ed Weir, or MyGov Expert, and my YouTube page will pop up. And these are under the live link. There's a little tab on top. There's videos and then shorts and live. I do most of these live nowadays because editing and all that fancy editing just takes too much time. There's a bunch of videos out there with all kinds of fancy editing and stuff, but they don't provide good information. So I plan on retiring in 4 years when I turn 65. What month do I start applying for Social Security? Yeah, a couple, 3 months before is plenty of time. Just make sure you check your earnings record. You can apply online. Since you're doing it at 65, at that time, if you're still working and still have health insurance from work and you're happy with it, your employer has 20 or more employees at that time, then you don't have to sign up for Medicare. So you can just start your benefits. You sign up for Part A because that's free, unless you're, paying an HSA, unless you have a health savings account you're contributing to. I turned 62, not on Medicare, receiving calls that I qualify for additional Medicare benefits. Yeah. The FTC and the FCC and Medicare and everybody has finally come together, and they're trying to put an end to that. People selling your information. But yeah, with the Supreme Court ruling, all bets are off now. So I'm not sure whether, yeah, the calls, I thought they were going to decrease, but given what the Supreme Court just ruled, they might multiply times hundreds. So everything is about how corporations can make more money now from now on. So that's the only consideration. I'll talk about all that tomorrow. I'm still processing it. 51 with Parkinson's, turned down for SSDI. I only make $1,800 a month. What can I do? So yeah, Parkinson's, different levels. But if you're making 1,800, then maybe at the time you applied, you were making a little bit over. But yeah, you're going to be over the limit, which is $1,550. So you're making over $1,550. So that's why they denied you for disability benefits. I turned 65 in August and still working. Do I have to claim Medicare? I work for a large company. Nope, you're good. As long as you're happy with your health insurance, you are good. You don't have to do anything. Once you stop working and stop receiving health insurance from work, then at that time, start your Medicare. I recommend a couple of 3 months before your Medicare is going to, your health insurance from work is going to stop, and that way your health insurance from work stops the end of the month, and your Medicare starts the first day of the next month. And you just have to fill out a couple of forms at that time to prove that you actually had health insurance from work since you turned 65. Sheila, you are so knowledgeable and helpful. Thank you. Yeah, you're welcome. Let's see here. If I try to get disability and my husband is retired, will that affect Social Security? Nope, not at all. If you're just talking about Social Security disability insurance, no effect at all. If we're talking about SSI, the welfare-based program, then yes. But regular disability, not at all. Apologies if you explained it already. No problem. Difference between SSDI and SSI. SSDI is Social Security disability insurance, what you actually paid into when you pay FICA. SSI is a welfare-based program. You can get SSI based on your disability or if you're aged. So if you know somebody that's like 65, 66 or older, and their retirement benefits, they're only getting like $500 from Social Security, and they don't have any other income or resources, please tell them to apply for SSI so they can get some more money, please. And I know there's millions of people out there that are hurting, so we need to help. Oh, by the way, I keep forgetting to mention this. On my YouTube channel, on the community or the posts tab, I put some flyers in there. So please print off those flyers and post them everywhere, community centers and health, wherever, places of worship. Please, we need to get the word out there and get people to get the benefits they're entitled to. I will return for retirement next August. Can I begin drawing my survivor benefits starting January? Yeah, absolutely. And that is an option. So you can start your survivor benefits if you're entitled to, and married to the person for 10 years and all that kind of stuff. Get your survivor benefits, start those, and then don't touch yours. Yours will continue to increase all the way until you're 70, but collect your survivor benefits. And then, when your benefit on your own record gets to X amount that you like, then switch from survivor benefits to your benefits on your own record. Isn't there a penalty for applying for Medicare later than 65? Yes. But if you have health insurance from work and your employer has 20 or more employees, your work or your spouse's work, then there's no penalty at all. Yeah, a lot of people are paying for Part B premiums when they don't have to. It's like, yeah, I hate having to pay for this $174.70, because I don't use it. I've got my, my wife's or my husband's health insurance. I've got health insurance. I'm like, then why are you paying it? And it's like, well, I thought it was mandatory. No, there's unbelievable amount of people that, yeah. Uh, let's see. Does Medicare cost money at the age of 65? Part A is free. The premium, that is, zero premium. Part B is $174.70. But then original Part A and Part B are great, but they have 6 gaps. The biggest one is the Part B gap, where you have to pay 20% co-insurance. So if you have a $100,000 surgery, you have to pay $20,000 out of pocket. So that's why people either get a Medicare Advantage plan or a Medicare supplement plan. I've got a few videos on that. I recommend Medicare supplement if it's in your budget. That way you don't have to deal with pre-authorizations and networks and stuff. But if not, then Medicare Advantage is an excellent option as well. You just have to keep up on those a little bit better. Sheila, we must be careful to keep medical D coverage. If not, Social Security charges a lifetime penalty. Correct. Not just for the amount of time you weren't covered, a lifetime. I did not know that until it was too late. Yeah, and that's going to get worse in terms of people not signing up for Part D. So the people that forget to sign up for Part D are the people that sign up for Medicare supplement plans. Medicare Advantage, most of those have Part D already wrapped up in there, but Medicare supplement plans, you have to get Part D. And what often happens is when you sign up for Medicare supplement, whoever helped you sign up, again, didn't do their job and didn't tell you that you also need a Part D, or you tell them, I don't take drugs, I don't want it. And they don't make any money, especially going next year. Yeah, agents and brokers aren't going to make money pretty much across the board for helping you with Part D. So nobody's going to want to help you on that. So there's going to be a lot of people penalized because the agents and brokers don't want to talk about it, because they don't want to waste their time, because they're not going to make any money. So it's going to be very, very bad. So yeah, even if you don't take drugs, you might take them in the future. So 5 years, 10 years down the line, if you end up needing the prescription drug part, you'll have to pay a 1% penalty for every month you do not have it. So if that's 10 years, that's 120% penalty. And you're saying, well, that's not too bad, because the penalty of what? The penalty of the premium. Well, the premiums aren't too bad. They're like $30 or so average throughout the country, right? Well, next year, all bets are off. I've seen, 2 or 3 times increase next year. It's going to, everything is, Social Security and Medicare, as we've noted up until now, it all changes next year. Since the Supreme Court decision yesterday, all bets are off. So, yeah. All right. All right. And let me try to cheer back up here a bit. When I turn 65, my employer will pay 100% of their company insurance, rule of 80. Well, I have to choose the Advantage plan, or will I have the option to choose a supplement plan? Yeah, when you're 65, you can choose whatever you want. But sometimes those employer plans, if it depends on the employer plan. A lot of employer pension plans are signing people up for Medicare Advantage plan, but then they pay this and pay that. So those are usually pretty good. But it really depends on your particular area, what your employer is going to provide, what they're going to pay for, what your health needs are. So yeah, there's just too many variables. So once you turn 65, reach out to someone you know and trust. I recommend brokers, agents, traditional Medicare, any type of agents, called captive agents. They work for one company. So it's like the old, I always say Henry Ford, you can have any color car you want as long as it's black. So if you choose a captive agent and they work for XYZ Medicare insurance company, guess what company they're going to recommend? XYZ. So I only work with brokers that work for multiple companies in the area. And so they work for you. So they ask you a bunch of questions. What do you need? What are you looking for? Do you need more dental? Do you need lower costs? Do you need, you don't want to deal with networks or pre-authorizations? They ask you all those questions and they say, okay, well, here's the best 1, 2, 3 plans for you. And then you pick which one you like. And that's completely free. And if you choose, again, how it works, if you choose the one of the plans you like, that person is licensed and contracted with that insurance company. They enroll you in that plan, and then that company pays them the commission. If you just say, "Well, I'll just save money and you know, thank you for introducing me to that company. I'll just enroll directly." That company just keeps the commission, so it's the same exact price to you, no change whatsoever. So is it true that starting 1/1/25, if your work healthcare plan has an out of pocket is 2,000, you have to sign up for Part B? Um, has an out of pocket is 2,000. I haven't heard that, but that's I think this is going to be a common statement I'm going to make for the next 10 years based on the new Supreme Court thing that everything is going to, yeah, the laws and everything is where it's going to be a nightmare trying to keep up on stuff. But um, healthcare plan has an out of pocket of 2,000. You have to sign up for. Yeah, yeah. I mean, health plans can mandate you to do stuff like that. So that's probably your health plan mandated, but I don't think across the board I've seen anything like that. But your health plan is might say, hey, you have to sign up for Part B, because what they're doing is they're looking to save money. They're looking to move costs over to the federal government as much as possible and save money. So if you were married 10 plus years and been remarried and divorced, can you apply for survivor benefits? Absolutely. If you're now currently single, and if even if you remarried, but as long as you remarried after 60 years old, you can also collect survivor benefits. Can a wife and an ex-wife both draw Social Security from the same man? Would the Social Security be reduced because both draw? Absolutely not. One doesn't affect the other. I mentioned, the family max and stuff, but that doesn't apply to divorced spouses and stuff. So you could have, which I've had cases where people come in and it was an ex-wife came in, filed for benefits, and then another person, another ex-wife, because this person just passed away, and another ex-wife came in and filed for survivor benefits. So it was like two, and then the actual surviving spouse, the actual person that was married to them. So three people got surviving spouse benefits, and nobody knew. I didn't say, hey, Jane was just here yesterday. No, Social Security doesn't do that. You don't know who's receiving benefits and how much. They're obviously reducing. Well, I guess you do know how much because it's the same exact amount you're receiving. So everybody receives the exact same amount. If they retired at the same age. So guess I have to put that in there too. What new Social Security ruling are you talking about? It's a Supreme Court ruling that came, the Chevron deference. Yeah, the Chevron doctrine is gone. Anybody tell you look like Bill Maher? I don't smoke anywhere as much as ganja as Bill Maher does, I don't believe. I didn't hear your response if you gave one. Relative 70 didn't sign up for Social Security to now. What can they? Yeah. Watch my video. Just repeat. And I answered that one. Took about a few minutes, but yep, I answered that one. Is it true this? Okay, I already answered that one. Let's see here. See if I missed anybody. When I apply for disability, do I have to put my husband's info on the form? Again, if it's SSDI, Social Security Disability Insurance, you're actually paid into Social Security, then no. I mean, no, you don't. No. They'll ask you, are you currently married? And if you don't want to, you don't have to. But if you're filing for SSI, the welfare-based program, then yes, you do. Because SSI is a welfare-based program, and if you marry someone and that person makes $1 million a year, then they're going to say, yeah, no, you don't need welfare. If you take a early retirement at 62, can you get the full at 67? No. Well, again, exceptions. If you take your benefits at 62 and then work and earn way over the annual earnings limit and never receive a check, then yeah, once you turn 67, then you'll get your full benefit amount because you never received a check, even though you filed. So, but yeah, I'm getting way down in the weeds in this one. But yeah, if you file for 62, your benefits won't go back up to the full benefit amount 67. If that was the case, everybody in the country would file at 62. Let's see here. I mistakenly thought I was eligible for half my former husband's Social Security. However, it is a total of mine and his equals half. Yeah. All right. So, yes. So you're entitled to up to half minus your own. So if you're entitled to $1,000 from your spouse, current spouse, divorced spouse, surviving spouse, so you're entitled to $1,000, but you're receiving $400 from yours, then you'll continue to get your $400 plus $600 for a total of $1,000. You won't get $1,000 plus 400 equals 1,400. You get that amount minus your own. Yeah. And that works with all the programs. Jackie, 60, husband 62, still early for Medicare, but wanted to know if take regular Medicare Part B and keep health insurance later, could you get Medigap or supplement? Trying to not pay a lot for PET scans and stuff. All right, so let's see here. Okay, we're talking a few years down the line, which, yeah, we don't now know what's going to happen. But if you take regular Medicare Part B and keep health insurance later, could you get a Medigap or supplement? No, because it's based on your Part B start date right now. So either at 65 or when you start Part B, when you start, so you can start your Part B at 70 years old, and then you're entitled to get a Medicare supplement, without any underwriting or anything. But if you've already started Part B, then that starts your clock. I want to sign up for Social Security in January 2025 or in March, but I'm worried there is going to be a resistance with the Social Security office because of cutoffs or short staff causing wait time. Yeah, the Social Security is at a 27-year low. So yeah, but yeah, just call up in November, December, schedule an appointment, or go online. And if it takes them, longer than normal to adjudicate your claim, then they will pay you the back pay, whatever you're entitled in terms of back pay. If I have currently Medicare Part A and B, I have the Advantage plan right now. Then I am 63 and I will turn 65 in January. And the way I understand it, I will be eligible. Don't have anything else. He's probably typing. So, but I already know what he's going to ask. But he'll be eligible for a Medicare supplement because he has a Medicare Advantage plan. Yes, yes. So you are receiving Medicare because you're receiving disability under 65. And in most states, you can't get a Medicare supplement plan, or if you do, they give you the crappy ones or the expensive ones. But when you turn 65, that no longer applies. When you turn 65, you're in that awesome window where you can get any Medicare supplement plan. Again, I recommend an N or a G. And they can't ask you any health questions. They can't charge you more. And yeah, it's a beautiful thing. So yes, when you turn 65, definitely check out and see if a Medicare supplement plan is right for you. It's all about budget. I believe if it wasn't a budget issue, the monthly premium, everybody in the country would get a Medicare supplement plan. No ifs, ands, or buts, because they don't have to, go through, networks and is my doctor covered today or is it going to be covered next week, and you don't have to, ask the insurance company for permission to do X, Y, or Z. So yeah. Oh my God, everyone should talk with you in planning for the Social Security future. Well, most would realize they can't live on it. Yeah, unlike me when it's too late. Very poor life. Yeah, that's one of the big reasons I came out of retirement after I retired from Social Security, is if I had a nickel for every time someone at Social Security says, well, I wish somebody would have told me that 10 years ago or 20 years ago, or, last month when I filed, I would be, billionaire. But yeah, so that's why I've done over 500 videos, and I'm doing these live Q&As all the time, trying to get people, the information that Social Security, unfortunately, is doing a terrible job. I mean, they're just barely keeping up with the phone calls and people walking into the office and all the rest of it. So they just don't have the budget to go out there and say, hey, by the way, if you're on disability, you're also eligible for survivor benefits and spouse benefits. And if you're on Medicare, maybe you're eligible for SSI and Medicaid. And yeah, they just don't have, the money or the budget to do stuff like that. So that's what I'm trying to do. Can you get Social Security benefits over age 70 and disability for illness same months? No, there's no disability. Nobody in the country is receiving disability after their full retirement age. So if your full retirement age is 66 or 67 or whatever, you're automatic. Everybody in the country that receives disability is automatically switched to retirement benefits once they hit their full retirement age. So nobody gets disability after their full retirement age. But yeah, you can apply for Social Security benefits if you haven't applied for Social Security like that previous person, and for whatever reason, then yeah, 70 is the max. You can still get it at 75 if you've just forgotten, but you've lost tons of money. So when I apply for disability, will I get health care? Yes, if you are approved for Social Security disability insurance, not SSI, but Social Security disability insurance, then you get Medicare after being on disability for 24 months. So a lot of people miss that and they go out there and buy health insurance and they're spending all their money on health insurance. And then they, realize, oh, wait a second, what's this Medicare card over here? And yeah, so they've wasted a lot of money. Married 34 years, divorced, 72-year-old, have my Social Security. Can I get my husband's amount? Married 34 years, divorced. Yeah, so divorce spouse benefits, absolutely. If your husband's is twice your amount, then absolutely, you can get up to 50% if it sounds like they're still alive and kicking out there. So the best way to do it, you're like, well, how do I know how much they're getting? Call Social Security and say, hey, I want to file for a divorce spouse benefit. And yeah, and they'll tell you whether there's extra money there. And if they say something stupid like, well, your ex-spouse hasn't filed for benefits yet, then just tell them, well, okay, then I want to file for independently entitled divorce spouse benefits. And hopefully the Social Security employee will be intelligent enough to know what that is. So yes. All right, let's do one more question here, or two more questions. Let me see here. I have my ex-husband, $40,000, and it doesn't care. The state goes, and my son is 30 old. Yeah, I'm sorry. I'm not sure how to read that. Work and get Social Security benefits. I work full time and 69 years old. Yeah, if you're 69 years, absolutely. A billion, nothing is withheld from some terms of annual earnings limit. Yeah, once you hit your full retirement age, then you can make all the money in the world and nothing is withheld from Social Security. Actually, it might increase your Social Security benefit, because if you're 69 or 70 or 90 or 100, and if you continue to work and pay into Social Security, the FICA taxes, and that's one of your high years of earnings, then Social Security automatically does the calculation and increases your benefit amount because it's based on your high 35 years of earnings. Yeah. All right, last question. Would you have to be married for a minimum number of years to receive the divorce benefit? Yes, you had to be married for 10 years. So, and they're not necessarily consecutive. There are some people that were married for 5 years, they get divorced, they remarry the same person the year after and married another 5 years, and Social Security can add those periods of time together to equal 10 years. All right, y'all have an awesome night, and I will be back tomorrow after I digest all of the depressing news. But